The six principles of the public health response that Masks for Canada is looking for is one, that we take a proactive response, that we anticipate problems and take measures in place before they become unmanageable, as opposed to a reactive response. Second, we are asking for an effective and consistent policy across Alberta, which is to say we want mask mandates that are presently in place in Calgary and Edmonton and some other municipalities to be made consistent and across the board across the province of Alberta. We are asking, thirdly, for an immediate adoption of the federal COVID app. Alberta is one of only 2 provinces that has not adopted it. We don't accept that there are any barriers in Alberta to it that didn't exist in Saskatchewan or Ontario or Quebec, that put it in place, and that it is putting Albertans at risk by not having access to this tool that is available to our Canadians in 8 provinces. We are asking that there be an acknowledgement that airborne transmission is an important factor in the transmission of COVID-19, and therefore that there are mitigations like improved ventilation that are required in order to address the risk of airborne transmission. Fifth, we are asking for equitable policy that recognizes the disproportionate impact to at-risk communities, the BIPOC community, prisoners, the homeless, people with lower socioeconomic status, and as well equity for businesses that are going to be disproportionately affected by the kinds of measures that need to be in place, inherently high-risk venues like indoor dining and fitness centers. And finally, we are asking for transparency, that data be made available, that reports about outbreaks, root cause analysis, findings are made available as soon as possible, so that we can learn and have confidence in the data that's out there and take the steps that the data tells us to take.